Namaste, sir.
Namaste.
I am Shravani Krishna Kumari from Vijayawada. I am introducing sir. Sir is Mr. Dr. Vedagiri Ganeshan, Dean of Social Sciences, Texila American University, South America. Honorable Director, Global Institute of Behavioral Technology, Bharatiya University, Coimbatore. The ex-professor of Head of the Department of Psychology, Bharatiya University, Coimbatore. I want an interview from you, sir, due to Mental Health Day.
Sure.
What is the importance of Mental Health Day, sir?
Today is the World Mental Health Day, that is 10th of October 2021, and every year throughout the world people celebrate the World Mental Health Day. And the World Mental Health Day is celebrated and encouraged by the WHO, World Health Organization. And World Health Organization was mainly focusing on health for several decades, and later they reconsidered health, and they said because of medical research and research by psychologists, they have found out that the emotional health affects the physical health. So the root cause of physical health is mental health. What a person thinks, feels, all these things affect the attitude to life, the attitude to people within the family and to the community and in the workplace. All these things, they are the human factors, human relationship factors and emotional factors. They affect the physical health. And they said there are a list of psychosomatic illnesses, and it's a long list for every serious problem, including a cardiac problem, or depression, or suicide, or alcoholism. The root cause may be emotional. Okay? So the emotional management is important prior to physical or medical management. And the habit in which they are thinking and feeling or imagining needs to be changed. And it can be done by psychologists who are working in the area of behavior therapy, and with that they will train people to have control over their emotions. For example, somebody is very aggressive, or someone else is having short temper. That will spoil their performance. So they will be trained in anger reversal technique. What is anger reversal technique? Is they will switch on anger and switch off anger and calm down. It is just like driving a vehicle to a dead end and reversing the vehicle. You need not lift the vehicle and keep, but if you put on the reverse gear, the vehicle will move in the reverse. Similarly, a person can switch on anger and stop it and reverse the anger and calm down. And it involves skeletal-muscular exercises of the limbs and also the eyes and the breathing rate. So this is a very comprehensive training which can be given to school children, college students, executives, housewives, for that matter, anybody in any position. It can be given to professionals also. They may be professional, but they may be short-tempered. And this short-temperedness or getting angry quickly will create blood pressure or cardiac problems, and they will be short-lived. Okay? Their lifespan may be restricted because of anger alone. When a person gets angry, the hormones which are related to anger are released into the blood, and till it is excreted through the urine by the kidneys or through the air, through the lungs, it will continue to be in the blood, and it will make the person to be angry or hiked up they are also known as psyched up. Okay, suppose somebody drives a four-wheeler and they get down to go to a shop for shopping. If they don't stop the engine will go on and the petrol will go on like that. Okay, so similarly, an angry person, if he doesn't know how to switch off the anger, then his energy will be wasted, and also he will have peptic ulcer, okay, migraine headache, or even blood pressure, etc. So the way of thinking and feeling and regulating emotions are to be trained. So these things will help the parents, the teachers, the students, and including the doctors and medical practitioners also. They can learn how to help people to reduce their anger, because that is the root cause for quite a few serious life-threatening illnesses, and they will become diabetic, etc. So it all centers on the blood chemistry, which is influenced by the emotion, and the emotion is influenced by the learning and the habit, and that is a very important thing. Like that, there are several other emotions like anxiety. An anxious person will have insomnia, unable to sleep, and appetite will also go down. They cannot eat food. Okay, appetite will be lost and they will lose weight. Or in other words, some anxious persons will go on eating and they will put on weight. So anxiety has to be removed, and that is possible with certain exercises of relaxing the mind and the body and the breathing. And the psychologists trained in behavior therapy, they can help these people to come out of anxiety. And as an extension of anxiety, there are over 500 phobias, and phobias means irrational fear. Okay, they need not be afraid, but they are afraid. Rationally, there is no reason to be afraid of a cockroach or a dog or a cow or darkness or marriage or childbirth. But these people become panicky, okay? It is all because of their imagination and thinking, etc. So it is affecting their life. And some people will avoid marriage. Some people will postpone marriage. All these things happen because of phobias. A bright student cannot take the exam because of the exam phobia. So the human effectiveness is affected, and behavior therapy can help to a great extent. Similarly, there are other emotions like depression, which will lead to suicide. So for suicide prevention also, and also to come out of depression, there are exercises. One such exercise which can be used is a sleep deprivation technique. So if a person is considering suicide, ask the person not to sleep for a whole day, a whole night, and next day also. So 12 plus 12 plus 12, a day, a night, and a day. If they keep awake, then their depression and suicidal tendency will go away. Similarly, there are other emotions like the reproductive emotion like sex. Okay, some people are afraid to get married, and some people get married and they are afraid to have sex. Okay, and in sexual behavior there are many abnormal behaviors, deviant behaviors, and all those things are correctable, including a sexual preference can be also changed and modified without any side effects. So somebody may be a gay, or somebody may be a lesbian, and somebody may be bisexual. So their behavior and preference can be modified with a systematic desensitization used by behavior therapists, psychologists. They can do that. And worry. Some people go on worrying. That also affects them. And worry will push them to suicide. Okay. There are specific techniques, very simple techniques, which can help a person to come out of worrying. There is a technique known as worry chair technique. Okay, a person may have a reason to worry, but what they are doing is they are over worrying. go on worrying continuously, and it leads to helplessness and hopelessness, and ultimately they will try to commit suicide. This worry chair technique is very simple. Whenever they worry, we will ask them to go and sit in a particular stool or bench or on the floor in a corner of the house, and the worry can go on. But once the worry reduces and stops, ask the person to get up and go and attend to the work. If they are students, they can go and study or write, and if they are housewives, they can go and take care of the household work, and if they are executives, they can go and attend to the work. But again the worry comes, ask them to go and sit in the same place or the chair or the stool, allow the worry to continue. But after some time, when the worry stops, ask them to go out and then continue the work, whatever work. So a person goes and sits in the worry chair for 17 times in a day on the first day. If they do follow this technique, worry chair technique, the next day it will come down to either 15 or 14. And the third day it will come down to 12 or 10. So it will come down to 1 or 2. And this coming to 1 or 2 is normal. Okay, you can pull them out of the worry pattern. And this worry pattern starts with the thought and ends with the blood chemistry, and the person cannot stop worrying. It becomes an addiction. It is just like alcohol or nicotine in the blood, which is initiated by the way a person thinks or imagines. And if it is changed at that level, basic level of cognition, okay, the way a person looks at life, it can be changed. It is known as cognitive behavior therapy, and that can save lives of people. And also it can increase the effectiveness of a person, whether they are wives or husbands or students or scientists or professionals, whether doctors or engineers. And this training can help to a great extent. And the World Mental Health Day focuses on such preventive techniques where the psychologists can play a leading role in helping people to trained to have control over their emotions, and if they gain control over the emotion, they gain control over the blood chemistry. Through the hormonal balance will be normal, and the blood will not be contaminated by hormones which are negative, and blood only goes to all the cells and all the vital organs. The health of all the vital organs like the brain, heart, lung, kidney, liver, etc., they are governed by the blood, the quality of blood that flows. The quality of the blood can be regulated by balancing the emotions, for which psychologists using behavior therapy can do a lot. And a lot of psychologists are practicing in our country and throughout the world. So the public can reach, whether they are housewives or husbands or students or teachers or professionals, without any hesitation they should make use of the services of the psychologist.